Hi, good evening. Austin Mayor Steve Adler. You got a minute? We're going to go through the two dashboards tonight just so you can see the numbers. Precariously close to red, but ambiguous information. You'll see that in a second. So we're on alert and on edge, but not quite sure what it is we're facing. It's Tuesday, so we'll go through a lot of the slides tonight. We'll go through them pretty quickly, but Tuesday is kind of data dump night. So let's go ahead and start. Let's pull up the first indicator. You can see admissions at 40. That's below the 7-day moving average. Remember, a couple days last week, we had 3-4 days in a row where we were up in the 50s. And it looked like we were precariously close to being get into 50 for the 7-day moving average, which would push us up into that red zone that you see in that center graph. But over the last several days, we've been down at 40. Which has now dropped the 7-day moving average from 47 yesterday down to 46 today. It wouldn't take very many days at 50 to push us up, but this is a good sign that we don't have the hospitalizations. It's not a number that's entirely consistent with the number on the other side of the page, which is 613 cases today. That's the most new cases that we've had since July in a single day. It's a couple hundred more than we had just yesterday. So we have a lot more cases, but yet the hospitalization rate seems to maybe not to be leveling off. Hard to reconcile those two things because cases usually turn into hospitalizations. Don't know what that means, but we can give some guesses at this point. The early indications are that the number of people, the people that are getting cases, younger and younger population. And when younger people get the virus, they're less likely to show up in the hospital. So we could have more cases, but not a corresponding hospitalization. That would be consistent with what we're hearing anecdotally from the hospitals, which is the people that are showing up in the hospitals were people that apparently, many of them, got infected over the 4-day holiday, the Thanksgiving Day weekend, the long holiday Thanksgiving weekend. These are people that got together with extended members of their family or with friends, not wearing masks, not really social distancing because it was family and not strangers. We've talked about that before. You still need to wear the mask, still need to social distance. In fact, at this point, especially on holidays, we need to avoid gathering in those kinds of groups. But if that's what we're seeing, and if those were the infections came from, then we would expect to see a greater percentage of people that are young getting the virus, participating in these family or extended friend gatherings. And maybe that's why the number's going up. We've asked to see the data so that we can ascertain what the age break was at that 613 number. But that is not how the data is reported to us. So I don't know if we're going to be able to get those information. The numbers in the middle of that page, the green numbers, showed us what the 7-day moving average was for hospitalizations, ICUs, and ventilators. And let's compare those numbers to this second dashboard, which is the actual numbers that we have. So 297 people in our hospitals tonight, just a little over the 7-day moving average of 286. That number is inching up a little bit, increasing the number of total people in hospitals. Number in our ICUs, which is the number that is the most scary to us, that's a 200 limitation we have in the city, was up at 90 and headed north. Has come back down a few numbers now, down to 87, and it was 86 yesterday. So we're not seeing an increase in ICUs the same way we see it in cases. But remember, too, that we see the cases several days before we see those cases turn into hospitalizations, several days before we see those hospitalizations turn into ICUs and ventilators. So they're kind of a trailing indicator. The 13 cases gives us 43,469. Number of people who have passed away, 507 today, which is the same number that we had yesterday. So no new deaths. So bottom line, we're seeing a scary number in the increase of new cases. Could mean that we're in trouble and that we're going to be seeing a lot more hospitalizations than a lot more ICUs here over the next several days, or not. It could be that we just have a 3 or 4 day peak associated with the Thanksgiving holiday. We're seeing new cases, but younger people that aren't going to show up in the hospitals, and we go up as we've gone up, and then we kind of level off and maybe come back down. So we're watching those numbers. And we'll talk about the risk chart later, because we have built into our system kind of an early warning. When we go into red, it doesn't mean that we're facing critical shortages at that moment. When we go into red, what that tells us is that it's an early warning that if we do not change our behaviors, then in 2 weeks, 2.5 weeks, then we're going to be overrun. So we've set our risk levels and our colors to give us the time to be able to impact our future and improve it. It's kind of like an early warning system that we're going to watch. If you wait until you're overrun, then it's already too late. And no matter what you do in your behaviors, the numbers are going to go up for another 2 weeks. But let's take a look at some of Dr. Escott's numbers today. The first one we're going to look at is the one that you see there. Those are Travis County confirmed cases. You can see how the yellow line, the 7-day moving average, is moving up. The blue are the numbers. Remember, those numbers that you see there, about 400, that does not show today's number because it wasn't available when Dr. Escott did his report of the 613 number. So that number is actually higher. Let's go to the next slide. The next slide is admissions. This is the one that we saw in that color chart on that first dashboard. This is just another representation. Yellow is the 7-day moving average. The blue line is the number of admissions. You can see it was up on the right-hand side there, and now it's come back down. But you can see the 7-day moving average now has moved up, and it is precariously close to 50, which is the number Dr. Escott's going to be looking at to trigger going into red. Let's look at the next slide. Next slide shows us in the blue line that you can barely see is that hospitalization line we just saw. The orange line is ICU admissions. The gray line down at the bottom is ventilators. Both those numbers in control at this point. But if that blue line continues to go up, you're going to expect the orange line and the gray line to follow. Let's look at the next chart. Next chart is the one that comes from the University of Texas. This is the modeler's work. All those dots are the admissions. That's the color-coded chart, and the chart we looked at just a second ago. What's instructive about this one is that aqua line over to the right. That tells you what the mean is of all the different scenarios, and you can see that the modeler is showing that a very likely scenario, the mean scenario, has us moving up through 50 into 60 and up through 80 as we get into January. That's why we're all watching the numbers, because we need to be able to prevent that from happening with our behaviors. Let's go ahead and take a look at the next chart. Next chart shows you cases by county. At the top is the overall Texas number. And then you have the other color-coded counties. You can see that Austin is the one down at the bottom, in the very bottom right. Travis County is doing pretty well, cases per 100,000 compared to our peer counties. You should be proud of that because that means that we're really taking care of each other here in Travis County. And also some concern, we look at the other counties. But generally speaking, many of us are kind of doing okay. Off to the right side there, obviously El Paso is still in a hurting area, but it's leveling off there. The next chart shows you cumulative deaths by county. Again, the same kind of thing. Austin, Travis County is that dark blue line in the bottom right. And you can see deaths per county. That's per 100,000 people. So it's been equalized. You know, you can calculate the number of lives that we have saved here in Travis County as compared to the number of deaths we would see if we were, say, in El Paso. El Paso number, you notice, is north of 180 per 100,000 people. Austin, below 40. So it's about 4.5 times El Paso where we are. 4.5 times our roughly 500 people who have passed away. Is about 2,300 people. That would mean we've saved about 1,800 lives here in Austin as compared to El Paso. Numbers vary if you look at the other counties. We should be proud of that because we react when it is we need to in order to keep our numbers low. And that means that people are generally wearing their masks as they should be in our city. Let's look at the next chart. The next chart is positivity. This is one of the shows us concern. These are everybody who's taking all the tests in our city, whether they show up positive or negative. You can see, a couple months ago, we were down to 3% positivity. We want to get below 3%. We were struggling to do that. Now we're up at 9%. Positivity 3 times as high, which means that if you go out onto the street and you stop a random person and you sit down next to them, they are 3 times as likely to have the virus today as they were just a couple months ago. That positivity tells us what the reach is of the infection in our community. Go ahead and take a look at the next slide. The next slide after positivity will show us I don't know, there it is, positivity by race or ethnicity. The gray line has gone up. That's the Latino community, up about 15%. So disproportionate representation as we've seen throughout this pandemic, but now reaching a number above 15%, which is of particular concern. American Indian, the green line, is up, but not a lot of people counted. But you can also see Black African American has gone up from about 7 to 9. And the Anglo population also has gone up, but not as much. You can see the green dot line is 3%, the red dot line is 5%. We want to be below the green dot line, and we're just not there right now. That's the positivity. Go to the next slide. This is positivity by age, and you can see that the positivity has gone up in all different age groups. Disproportionately, I think the younger groups, we talked about that just a second ago, where more and more people that are showing up positive were younger. Last week, 76% of the people that tested positive were under 50. So that's a sign that the people getting the infection are younger. Which is why a bigger case number may not translate into hospital numbers. Let's keep our fingers crossed that that's true. Let's take a look at the next slide. This is the other one that we're going to continue to track with flu. We want to make sure we don't have hardly any flu patients competing for ICU beds in our hospitals. Those colored lines show you where ICU, where flu, the number of flu patients. People who had the flu show, you can see it for 3 years, and that blue line in the bottom left-hand corner is where we are today. We want to try and just keep that at 1% straight across the board. We're doing a really good job of that. Let's go to the next slide. The next slide talks to us about the color-coded chart. We're in the orange area right now. We reissued the orders today because they were just about to expire, but just basically continued the orders that we had before, both me and the county judge, Andy Brown. The only real substantive difference was in Dr. Escott's order, where he's coming up with more rules right now about those restaurants that are really bars but are allowed to open as restaurants under the governor's exception. We have too many people drinking and kind of gathering with each other, so new rules about just trying to keep people greater social distancing and observant of safety factors in those environments because we're seeing challenges. Seeing challenges there. Those are all the slides that we have tonight to go over. The holidays are coming up. We see these numbers. We're learned from what just happened at Thanksgiving. New Year's Eve, everybody should plan on spending New Year's Eve just with your immediate family, not out partying on New Year's Eve gatherings. Let's not have people planning to do that so that we don't repeat what we're seeing here perhaps with Thanksgiving, even over the Christmas holiday. Let's not have extended families, extended friends gather. The vaccine is so close. We've already started vaccinating people in our city. We're going to get the healthcare workers first, EMS, and then the folks in our nursing homes, and then start working down by age to get to the people that are most susceptible and in danger of having really bad complications or dying if they get infected. We're going to follow that. But it could be that, by going into the summer, everybody who wants the vaccine's been able to get it. We're going to be relatively safer even before we get there, because if everybody that's at substantial risk has been vaccinated, then if other people get it, odds are they're not going to have those kinds of complications. But we're going to be wearing masks and social distancing here for several months. So kind of make peace with that. Because that's going to be happening, but let's treat this one holiday differently. Holiday season coming up here, Christmas, New Year's Eve, differently, so that everybody makes it to a place where they get the vaccine and they are safe for many holidays to come. We really need to focus on helping each other, being selfless in this situation. Remember, you do a lot of the protections like face masking and the like, not to protect yourself. So, if you're kind of macho and don't wear a mask because you're willing to take the risk, understand that it has nothing to do with you. We wear masks so that the people around us are not put at risk. And we should be selfless that way. We should be thinking about trying to protect other people. We should also be thinking about supporting the businesses in our community. Again, buy gift cards, buy takeout food, let the restaurants cook. Let's do some online shopping. Please over tip your wait staff. Let's see, during this holiday season, a lot of businesses are losing their chief period of time of earning income. To the degree that you can, let's support them too. Let's all take care of one another. And with that, I guess we'll all go see election results. You all take care, be safe, and have a good night.